Hello, everyone. My name is Rachel Craig, and I will be doing a presentation on providing culturally competent care for Muslim patients. So to start, we have the practice of Ramadan, which is a time of fasting for these individuals. So those who are not required to fast include children, menstruating women, pregnant lactating women, the sick and the elderly, and those traveling. And then diabetics often are questioned during this time of fasting, and diabetics are allowed to fast. Accommodations can be made so those with health conditions such as diabetes can participate in this fasting period. And then hospitals should know that many Muslims like to break their fast by eating dates, so that could be provided as well for those. Provider to patient care, dietary considerations. Many Muslims have many restrictions considering dietary needs. So permitted foods are considered halal. Not permitted foods are haram. And there are also the foods that are in the middle or doubtful or questionable considered mashbu. And these are food products and ingredients where sources are not known. So as you can see, there are certain foods that Muslims partake in and certain foods that they do not. So it is important to keep that in mind when serving food to Muslim patients. Medication considerations. Haram products are forbidden at all times. And then there are medications that are considered to break the fast, such as oral medications and IV fluids. So the best way to provide medication for these patients is using inhalers, nasal sprays, and nebulizers. Prayer considerations. Prayer is essential and practiced by devout Muslims, and they often include cleansing rituals, use prayer mats, face the direction of Kaaba in Mecca, and they pray 5 times a day. So as a healthcare administrator, we should take in mind that the hospitals could position the beds towards Mecca, so those that are bedridden can still participate in this practice of prayer, and also take in consideration the time of day that prayer occurs, so that sacred ordinance can be performed by Muslims without disruption. Care of the body after death. Family dynamics and healthcare decisions is really huge. Strong extended family support and extended family members are often consulted at all important healthcare decisions. So that should be kept in mind when making important decisions of the body after death or just important healthcare decisions in general. Gender considerations and sensitivity. When providing care to a Muslim patient, it is expected that the provider is the same gender as the patient. And then if a male is examining a female, another male should be present in the room. And also be keeping in mind that opposite gender touch is uncomfortable and minimal eye contact is preferred. After birth practices, there are many Islamic customs. Shortly after birth, the adhan is whispered into the ear of a newborn. And there are also practices after birth such as tanik, akika, and circumcision. So healthcare providers should be aware that these practices may want to be performed after birth by these Muslim patients. Modesty is an important part of the Islamic faith. Many Muslims prefer to be completely covered, but there's also variations in that. The hijab is a general term for a modest dress code, which is the scarf covering the hair. And then a hospital can respect and maintain that modesty during examinations, procedures, and hospitalizations by closing doors and curtains, only exposing areas of concerns, and knocking before entering the individual's room. As in all religions, circumstances vary, and some people are more committed to the religion than others. But as healthcare providers, it is important that we have this sort of baseline of understanding for certain populations so that we can provide that care in respect and being culturally competent and just having that overall respect for these individuals.